If we do nothing, your premiums will continue to rise faster than your wages. If we do nothing, more businesses will close down. Fewer will be able to open in the first place. If we do nothing, we will eventually spend more on Medicare and Medicaid than every other government program combined. That's not an option for the United States of America. So Minnesota, I may not be the first president to take up the cause of health care reform, but I am determined to be the last. Than we've ever been. We've debated this issue for better than a year now. And there's actually some solid agreement on about 80% of what needs to be done. That's never happened before. Our overall efforts have been supported by an unprecedented coalition of doctors and nurses and hospitals and seniors groups. Even drug companies, many of whom were opposed to reform in the past, this time they recognize, you know what, this is not going to be stopped. We've got to get on board. Now, what we've also seen in these last few months is the same partisan spectacle that has left so many of you disappointed in Washington for so long. We've heard scare tactics instead of honest debate. Too many have used this opportunity to score short-term political points instead of working together to solve long-term challenges. I don't know if you agree with me, but I think the time for bickering is over. The time for games is past. Now's the time for action. Now's the time to deliver on health care for every American. There's been a lot of misinformation out there. I want you to know about this plan that I announced on Wednesday so that when you go talk to your neighbors and your friends, you're at the water cooler, buying Starbucks or whatever it is. I want you to be able to say to people, here's what's going on. Provide more security and stability to those who have health insurance. It will provide insurance to those who don't. And it will slow the growth of healthcare costs for our families, our businesses, and our government. Let me give you some details. First of all, if you're among the hundreds of millions of Americans who already have health insurance through your job, or you've got health insurance through Medicare, or Medicaid, or the VA, nothing in this plan will require you or your employer to change your coverage or your doctor. All right? I want you to be clear about that. Let me repeat. Nothing in this plan requires you to change what you have if you're happy with it. What this plan will do is to make your insurance work better for you. So under this plan, it will be against the law for insurance companies to deny you coverage because of a pre-existing condition. When I give a year or a lifetime, we will place a limit on how much you because the United States of America, nobody should go broke because they got sick. And insurance companies will be required to cover, at no extra charge, routine checkups and preventive care like mammograms and colonoscopies, because there's no reason we shouldn't tax credits so that they can do it. And the first few years that it takes to set up the exchange, because it will take a few years to get this all set up even after it passes. But in the meantime, we want to make sure people get some immediate help. So we're going to immediately offer Americans with pre-existing conditions who can't get coverage right now, we want to give them some low-cost coverage that will provide them protection from financial ruin if they become seriously exchange. One of the options, most of the folks who are going to be offering insurance through the exchange are going to be private insurers. You know, Blue Cross Blue Shields, all these. But I think one of the options should be a public insurance option. It would only be an option. Nobody would be forced to choose it. No one with insurance would be affected by it. But what it would do is provide more choice and more competition. It keeps pushing the private insurance to keep their policies important, to treat their customers better. I mean, think about it. It's the same way that public colleges and universities provide additional choice and competition to students. That doesn't inhibit private colleges and universities from thriving out there. The same should be true on the healthcare front. Different ideas on how to set this up. But I'm not going to back down from the basic principle that if Americans can't find affordable coverage, we're going to provide you a choice. And I will make sure that no government bureaucrat or insurance company bureaucrat gets between you and the coverage that you need. That's a promise. Now, a lot of you might think this plan sounds pretty good, or when you're talking to your friends or neighbors, they might say, yeah, that sounds all right, but let me ask you this, how are you going to pay for it? And that's a legitimate concern. We inherited some big deficits. And some big debt. And we've had a big economic crisis that has required us to take some extraordinary steps. So we're going to have to get control of our federal budget. We have to do it. So it's a legitimate question, but here's what you need to know. First of all, I will not sign a plan that adds one dime to our deficits, either now or in the future. No ifs, ands, or buts. Part of the reason that I face these $1 trillion deficits when I walk into the door of the White House is because there were a lot of initiatives over the last decade that weren't paid for, from the Iraq War to